An estimated 2.1 million children under the age of 15 are living with HIV/AIDS today. Most of these children acquire HIV from their mothers during pregnancy, labor, or delivery. Transmission of HIV from mothers to their infants can often be prevented through the use of antiretroviral drugs, safe delivery practices, and safe infant feeding, all of which are provided through programs for prevention of mother-to-child transmission, or PMTCT. These interventions can reduce the chances of infection from about 40% to 5 to 10% or less, depending on which interventions are available. However, even within good PMTCT programs, some infants do become infected with HIV. Early diagnosis of HIV allows children to receive appropriate medical care, often before they have significant illnesses, and to remain healthy despite their HIV infection. However, early diagnosis of HIV in infants cannot be done using the standard HIV tests that are used for adults, because these tests detect HIV antibody. Even uninfected infants have HIV antibody from their mothers, often until they are more than a year old. A laboratory technique called polymerase chain reaction testing, or PCR, makes it possible to diagnose infants as early as at birth. In most settings, testing of HIV-exposed babies is recommended during regular health visits at 4 to 6 weeks of age. HIV PCR testing looks for the DNA of the HIV virus, not for antibody. The PCR technique makes many copies of any HIV DNA that is found in a small sample of blood. Once many copies are made, the HIV DNA is easily identified. In this way, we can accurately determine which infants are HIV infected. PCR testing technology is becoming more affordable and more accessible all the time. In the past, PCR testing required phlebotomy, which is not easily done on young infants in resource-limited areas. PCR testing can now be done using dried blood spots, which are easy to collect on even the smallest infants. Through the collection of an infant's blood on special filter paper, you are taking the first critical steps to make early infant diagnosis of HIV possible. Only a small amount of blood is needed and can be obtained from a simple prick of the infant's heel, toe, or finger. This is easier on the infant, the parent, and you. Dried blood spots can be easily stored and easily transported to the laboratory for analysis. While this technique is not complicated, it must be done correctly, or the sample may not be usable. Remember, a test result is only as good as the specimen collected. In this short film, we will demonstrate the skills you need to collect high-quality DBS samples. We will show you how to. Gather the supplies required for DBS collection. Collect DBS samples. Package and store DBS samples properly. Tell the difference between valid and invalid DBS. We will begin our training by watching a nurse gather her supplies for a DBS collection. Keep in mind that the supplies used by your program may look slightly different from what is shown. When gathering supplies, first select a sterile, disposable lancet or glucolate. Choose one with a tip that is 2 millimeters long. These sterile lancets or glucolates should be used one time only, then properly disposed of. This puncture depth is critical for all children, especially small babies. A 2 millimeter lancet is the correct length to puncture safely without damaging bone. Next, you will need skin disinfectant. Alcohol or spirits is the best choice. Then gather gauze or cotton wool. And be sure you have a new pair of gloves ready for each patient tested. Gloves with no powder are best. If your gloves have powder, you must wash it off before touching the baby's foot or the DBS card. Finally, gather your necessary lab forms. a DBS collection card, and a pen. To take a DBS sample, it is important to use specialized collection cards. These are made of an absorbent filter paper like Whatman 903 and are specifically made for blood collection. Now we will see how to take blood samples from infants. We will start with a small infant. Heel prick works best on infants between 1 and 4 months old, or less than 5 kilograms. Watch as this nurse collects a DBS from a young patient. It will be easiest for you to take DBS when the parent is seated at about your waist height. Take the time and care to help the parent get onto the table safely. After confirming this is the correct child to be tested, the nurse is labeling the DBS card on a clean surface with the appropriate identifying information and the date of the test. She's also taking care not to touch the circles on the card with her fingers or anything else. Contaminating the circles could affect the test result. It is important to set the parent at ease about how the DBS will be taken and to ask for their help in making the procedure quick and easy on the baby. Here the nurse is showing this mother how to warm her baby's foot. Blood will flow easily to the warmed area and spots can be taken with minimal time, trauma, and effort. If you are taking the DBS in colder weather, you can use a nappy soaked in warm water to warm up the foot if necessary. While the mother warms the baby's foot, the nurse can prepare to take DBS by thoroughly washing her hands before putting on new gloves. If your gloves have powder, wash your hands a second time to remove the powder. When taking DBS from a heel stick, the positioning of the baby properly with his or her foot down is important for a quick and clean collection. Usually the best way to do this is to ask the mother to put the baby on her shoulder, putting one arm under the baby's bottom. As you can see here, the nurse has selected where she will prick the baby's foot. For small infants up to about the age of 4 months and up to 5 kilograms, pricking the heel works well. The best area is the lateral section of the heel. Do not prick the back of the heel where the bone is. The area will then need to be cleaned. Wait 30 seconds for the area to dry completely because disinfectant left on the foot could contaminate the specimen. Gently squeeze the infant's lower leg and foot until it looks like blood will easily come out when the prick is made. Press the lancet firmly into your chosen spot while holding the foot firmly. Then depress the trigger so the blade punctures the heel. Wipe off the first drop of blood with a dry gauze or cotton wool. This first drop is not good for testing because it usually contains tissue fluids. Remember to properly dispose of the gauze in a biohazard container. Then let a second, large drop of blood form. You may gently squeeze and release the infant's lower leg and foot to increase bleeding. Do not squeeze right around the puncture site, as this will cause you to get tissue fluid instead of blood, and the lab will not be able to test it.
Now gently touch the filter paper to the large drop of blood. Do not press the paper against the puncture site or heel. Let the blood soak through and completely fill the circle.
For each circle, keep the filter paper against the blood drop until you see the blood fill the entire circle. Be patient. This process takes more time for some. If one circle does not turn out well, move to the next one. For HIV testing, at least 3 good circles are needed.
To care for the puncture site, gently press gauze or cotton wool over the wound until it stops bleeding. A bandage is not needed. Here the nurse is asking the mother to help her comfort the baby by keeping the gauze over the baby's wound while she completes the paperwork.
Now let's see how to take a DBS from a larger infant. When taking a DBS from a larger infant, the procedure is much the same, but you may have more success pricking the toe instead of the heel. Toe prick works best on larger infants who are about 4 to 10 months old or more than 5 kilograms. Remember to start by gathering your necessary supplies. You will need a 2 mm sterile lancet, a container to safely dispose of lancets, skin disinfectant, preferably alcohol, gauze or cotton wool, new gloves, the appropriate lab forms, a DBS collection card, and a pen. Help the parent and baby onto the table safely. Then confirm you have the correct patient before filling out the DBS card with the appropriate identifying information and the date of the test. Take care not to touch the circles on the card with your fingers or anything else. Now let's see how DBS is taken from a toe. Take some time to explain the DBS collection to the parent and ask them to help position the baby and make him or her as comfortable as possible. Here the nurse is showing the mother how to warm the baby's foot with her hand, which will help the blood to flow more easily for collection on the card. While the mother is warming the baby's foot, you can wash and glove your hands. Remember, if you are using gloves with powder, rinse off the powder before touching the baby's foot. For DBS collection from the big toe, ask the mother to help you position the baby with the foot hanging down so that you can easily access the toe. Ask her to hold the baby up over her shoulder with one arm under the baby's bottom. The nurse has selected where she will prick the baby's toe. The best place to prick is the lateral side of the big toe. Use only a 2 mm lancet and take care not to prick the very end of the toe where the bone is close to the skin. Clean the area selected and allow it to dry completely. Hold the baby's foot firmly with one hand and press the lancet into the toe before depressing the trigger. Note how the nurse has wiped away the first drop of blood because it also contains tissue fluids, which could make the sample untestable. Remember to properly dispose of the gauze in a biohazard container. Notice how the nurse is applying light pressure to the whole foot and not squeezing the place where the toe was pricked. Take care not to hold the foot too tight, as the baby may then resist and struggle. By using a gentle but firm touch, you will help the baby be more at ease. Now the nurse is collecting the blood spots by letting one drop fill each circle on the card. You should fill at least 3 circles with 1 drop each for HIV testing.
After you've finished taking the DBS, elevate the puncture site and apply gentle pressure with gauze to stop the bleeding. No bandage is needed.
You have now seen a DBS collection by heel prick and a toe prick. You may also need to take DBS by finger prick. The basics of taking DBS by finger prick are the same as heel and toe pricks. Finger prick works best if you are testing a big baby, 10 months or older, or more than 10 kilograms. The nurse is greeting and confirming that she has the correct patient before she fills out the DBS card with the appropriate identifying information and the date of the test. Take care not to touch the circles on the card with your fingers or anything else. After explaining the DBS procedure to the parent, ask them to help make the baby comfortable and warm their hand. Wash your hands, then put on new gloves. Remember, if you are using gloves with powder, you should rinse off the powder before touching the baby's hand. Ask the mother to help you position the baby with their fingers pointing down. At this age, most children can sit on their mother's lap while you take the DBS. You can also try to have the mother hold the baby in her arms, with his or her left arm behind the mother. As you can see here, the nurse has selected where she will prick the baby's finger. The best finger to choose is the ring finger on the left hand, as this finger will be least used by the baby. Select the lateral side of the fingertip. Do not stick the very end of the finger, where the bone is close to the skin. The thumb is not recommended because it will be the most painful. Clean the area to be pricked and allow the disinfectant to dry completely. Note how the nurse is using her hand to hold back the baby's other fingers. She's holding the hand firmly and pressing the lancet into the finger before depressing the trigger. Wipe away the first drop, which contains tissue fluids. Remember to properly dispose of the gauze in a biohazard container. Taking blood spots from a finger will be easier if you can hold back the baby's other fingers as you apply very gentle pressure to the whole hand. Hold the finger down to put the drop directly on the card.
Fill each circle by touching the card to the droplet. Filling at least 3 circles is recommended.
Elevate and use gentle pressure on the puncture site to stop the bleeding. Now that we have seen examples of taking DBS from heel, toe, and finger pricks, let's review what we have learned. To begin, let's review the materials you will need to gather to take a DBS. You will need a 2 mm lancet, a container to safely dispose of lancets, skin disinfectant, preferably alcohol, gauze or cotton wool, new gloves, the appropriate lab forms, a DBS collection card, and a ballpoint pen. When taking the heel, toe, or finger prick, you then need to follow these critical steps. Warm the area. Wash your hands, put on new gloves, and wash the powder off. Position the baby with its foot down or arm in a suitable position. Clean the area and dry for 30 seconds. Select the most suitable spot for the prick. Press the lancet into the foot and prick the skin. Wipe away the first drop. Allow a large drop to collect. Touch the blood drop to the card. Fill the entire circle with 1 drop. Fill at least 3 circles. Apply light pressure to stop the bleeding. And clean the foot or finger and use no bandage. While the best way to take a DBS is by heel prick, if a baby has had more blood drawn for other tests, you may need to make a DBS with blood from a syringe. Do not collect blood in a tube. Use only a plain syringe. When making DBS from blood in a syringe, you will need to take some of the same steps as with a heel prick. Fill out the DBS card with the appropriate identifying information and the date of the test, being sure to double-check your label with the paperwork and labeling from the original blood draw. Take care not to touch the circles on the card with your fingers or anything else. Then wash your hands and put on new gloves. If your gloves are powdered, you will need to wash your gloved hands as well. Now you're ready to make the DBS. This procedure is very simple, but must be done carefully. Ensure that you put the blood on the DBS immediately. If it has clotted or separated, the DBS will not be testable. First, gently depress the needle or syringe so that a drop of blood is formed on the tip. Then, touch the blood drop to the filter paper, being very careful not to touch or scratch the paper with the tip of the needle or syringe. Do not squirt the blood. You may fill all the circles with blood from the needle or syringe, but be sure to create at least 3 good circles. Your DBS card is now finished and ready to be placed in a rack to dry completely. After DBS has been collected, it is important to handle them properly so that they can be transported safely to laboratory facilities.
Before collecting a DBS for a patient, check to be sure the identification information has been properly filled out. Then after DBS collection, bring the card to the area set aside for drying. The cards should be set in drying racks horizontally, protected from sunlight, dust, and insects. Leave them at room temperature for at least 3 hours. If the DBS have been made late in the afternoon, they can be left to dry overnight or even over a weekend.
When drying specimens, do not expose them to heat or direct sunlight, store them in plastic bags, stack them against each other, or let them touch other surfaces. If a card has not been dried correctly and completely, it may not be able to be tested. Also, remember to keep the lab forms with the DBS cards. Once the DBS are completely dry, prepare to transport them in a sealable plastic bag. If you are sending more than one specimen at a time, be sure that the blood spots cannot touch each other. They must be separated by pieces of weighing paper, or the cards must be the type that closes. If they touch each other, blood may be transferred from one card to another, leading to incorrect results. Then, depending on the climate conditions, add between 5 to 10 dessicant packets to each bag. Then add a humidity indicator card to the bag, so the lab technician will know if there is too much moisture in the bag. All 3 circles on the humidity card must show a blue color to be useful. Press excess air out of the bag and seal.
Label the package.
Then if the packet is not going to the lab that day, leave it in a cool, dry place until it is ready to be transported. Avoid leaving the DBS in a vehicle, as sun and heat will deteriorate DBS. As you send out DBS for analysis, it is critical to properly label and document all the samples so that the results will be useful. Be sure you have completed all paperwork necessary to track each DBS. Place all of the lab forms and the plastic bag of DBS into the envelope. Be sure to label each bag with your clinic name, infant DBS specimens, and the date you are sending the specimens to the lab. Let's take a moment to review the information we've covered so far about taking and handling DBS. We have discussed the materials necessary for collecting DBS. We have covered 3 different ways of taking a DBS specimen directly from an infant. We have also discussed how to take DBS when intravenous blood samples are used. And we have provided instructions in handling specimens and preparing them to be sent to laboratories. Hopefully you are already feeling well equipped for your role in collecting DBS specimens for infant testing. Besides collecting and handling specimens properly, you need to prevent problems to make sure each test result is as accurate as possible. Here are a few pointers. First, keep accurate records. The most common reason the lab will reject a DBS is labeling errors. The lab cannot test a specimen if there are errors in labeling. Be sure all DBS cards are labeled and that specimen logs are kept accurately. Second, store the cards properly. This enables the samples to dry fully on the special paper. Third, prevent collection problems which can lead to unusable specimens. Here are a few common problems and ways to avoid them. This sample has yellow rings around the blood. This may have been caused by contamination of the specimen by the disinfectant. To prevent it, let the alcohol dry completely before puncturing the skin. If you are using betadine, detergent, or any cleaner other than alcohol, wipe it off completely before taking the sample.
Another possible cause is tissue fluids in the blood. You can avoid this by not squeezing the area around the puncture wound. A third possible cause is letting blood separate or clot in a syringe before putting it on the filter paper. These yellow rings means the sample will not be tested. Using too little blood also results in an untestable sample. If one of your drops is too small, move on to another circle. If you cannot get large enough blood spots, the infant's foot may be cold, you may not be squeezing enough, or you may need to choose another site and prick the infant again. If necessary, you may put a second drop on top of a small drop while it is still wet. If an infant is very sick, dehydrated, or malnourished, venipuncture may be the most suitable method to draw the required sample for DBS. On the other hand, using too much blood can also create problems. Try to use only one drop to fill a circle. Another problem is a layered sample. Notice how this specimen shows a darker spot inside a lighter spot. If a new drop of blood is put on top of a dry drop, the spot will be layered and will not be testable. To avoid this, do not add a new drop to a drop that is already dry. If you see a card that has layered blood